Hello, my name is Dominic Gilroy and I'm the Deputy Head of Knowledge and Library Services for Health Education England for the North West, North East and Yorkshire regions. I'm also the lead for the Workforce Development workstream of Knowledge for Healthcare. Today's session is looking at the workforce development elements of the Knowledge for Healthcare strategy. So let's move on now and begin the presentation. If you've joined previous presentations in this series, then the first few slides may be familiar to you, setting the context of the Knowledge for Healthcare strategy in relation to our aims and objectives. This first slide provides a quote from Navina Evans, Health Education England's Chief Executive. Navina became aware of the work of Knowledge and Library Services fairly early in her work for HEE. Let's read the quote. Applying knowledge into action is the currency of a successful healthcare organisation. Taking the heavy lifting out of getting evidence into practice to improve the quality of care, NHS Knowledge and Library Service teams offer the gift of time to busy healthcare professionals. Thinking then about the ambition for the Knowledge for Healthcare strategy. You may recall the premise of the #A Million Decisions campaign. Every day across England, more than 1 million decisions are made across the healthcare sector, which have a profound and lasting impact on people's lives, influencing both the quality and cost of health services. Knowledge is business critical because excellent healthcare and health improvement are underpinned by informed decision making. Let's look at the quote on the slide. Our ambition is that NHS bodies, their staff, learners, patients and the public use the right knowledge and evidence at the right time, in the right place, enabling high quality decision making, learning, research and innovation to achieve excellent healthcare and health improvement. This ambition should hopefully be familiar as it follows unchanged from the original Knowledge for Healthcare strategic framework. One important development since the launch of the original Knowledge for Healthcare framework is the launch and development of STPs and integrated care systems. In many areas of the country, local knowledge and library services have been able to begin to work across boundaries, delivering services into these developing organisations. Rob Webster, Lead Chief Executive at the West Yorkshire and Harrogate Integrated Care System, has access to the knowledge and library services of his own organisation, South West Yorkshire NHS Foundation Trust. He provides us with a quote on this slide. Our library and knowledge service enables us to be a learning organisation, ensuring that our staff are well supported to make informed decisions and to continue to drive innovation. Many of the listeners will be themselves knowledge and library specialists, and in that sense, I'm sure I'm preaching to the converted in this session. The strategy emphasises the importance of knowledge and library specialists in so many areas of work, aiding decision making, strategy, planning and performance, and thereby improving patient care, shaping policy and guidance, underpinning education, and facilitating research and the spread of innovation. Some colleagues have commented on the slight change in emphasis in the strategy, in the sense that we are now referring to our services as knowledge and library services rather than library and knowledge services. This change in emphasis is a deliberate attempt to move the mindset of senior managers and decision makers away from rooms full of books to the many value-added activities which our specialist workforce are involved in. This includes knowledge mobilisation activities and health literacy training, but also evidence searching, synthesis and summaries, and many other important areas of work. By delivering expert searches, knowledge specialists save staff time and improve outcomes. Knowledge services offer a range of other services to equip healthcare workforce to deliver evidence-based practice and innovation. You'll see the many different areas we've identified in the bullets on these slides. The recent value proposition Gift of Time report applied research evidence and case studies from our own NHS knowledge and library services to promote the time-saving contributions of NHS knowledge and library specialists to the NHS in England. We see growing demand for embedded knowledge broker roles responsible for searching and presenting evidence in a synthesised and summarised format. Today's NHS requires proactive knowledge services with a blend of expertise encompassing posts embedded in clinical and management teams delivering decision-ready information, and knowledge managers who mobilise both organisational knowledge and staff know-how to underpin strategy and operations. To enable the NHS to fully realise the value of our specialist workforce, Health Education England recommends that all NHS organisations aspire to improve staffing ratios for knowledge specialists per member of the NHS overall workforce. This can be achieved through incremental steps, redesigning services and roles, as well as expanding this specialist workforce. Thinking again of the Gift of Time report, this study performed a rapid review of 3 high-performing knowledge and library services, which were also hosted in trusts rated outstanding by the Care Quality Commission. This suggested some key roles for knowledge and library specialists in high-performing services. And these included roles in relation to clinical practice guidelines committees, taking leading roles in the governance and management of knowledge resources and knowledge assets, taking up embedded or clinical librarian style roles, and engagement and involvement with quality improvement teams. A large number of impact vignettes appear in the new strategy, many of which emphasise the skills and expertise of our knowledge and library specialists. They're based heavily on impact work shared by NHS knowledge and library colleagues over the past years, and the skills of our workforce feature in most of them. In this example of knowledge mobilisation techniques used at Lancashire teaching hospitals by the library manager and team, a living library model is used with the support of the Head of Diversity, Inclusion and Blended Learning. Instead of books, individuals are loaned out to colleagues for a conversation about their lived experiences in order to promote conversation and awareness. As well as being valued by staff, the event was flagged as good practice by the Care Quality Commission. We know that the most important element of our knowledge and library services are our staff. And therefore it's not surprising that we flag the critical importance of knowledge and library specialists and their skills in delivering the knowledge for healthcare strategy. Health Education England has a role in providing an element of leadership at both national and regional level, but there is also important work to be done at local level. Focused on the changing landscape and priorities of the NHS, we anticipate knowledge services working across larger footprints. This will call for flexible models of service delivery with multi-skilled knowledge specialists confident to work with senior stakeholders. And this will be a focus in our work to develop both the current and future workforce. An example of this is the work HE is leading to look at piloting knowledge and library posts across the primary care training hub footprints. So as we set off with the second part of the Knowledge for Healthcare strategy, we have a few figures to benchmark this point in time. We currently have around 1.3 million staff in the NHS in England and 184 NHS-funded knowledge and library services. At the point of launching the staff ratio policy, there was an average of 1 qualified knowledge and library specialists for every 1,730 whole-time equivalent NHS staff. And we also know that 59% of our workforce have LIS or KM degree level qualifications or above. We've mentioned already the staff ratio policy recommendation. You'll probably be aware that this recommends a ratio of 1 qualified knowledge and library specialist for every 1,250 staff. The strategy itself states, a capable and confident knowledge and library services workforce is needed in the right roles with the right numbers to deliver knowledge and evidence to the board, at the bedside and in community and primary care. Library and knowledge services with better staff ratios are more able to work proactively with a wide range of healthcare teams to enable evidence-based decision-making, impacting on treatment options and the quality of patient care, as well as impacting on productivity gains and cost improvement and the spread of innovation. The application of advanced technologies will change the roles and functions of knowledge staff and offer them exciting opportunities to innovate and extend their roles. We'll move on now to look at the strategic approach to workforce planning and development in the strategy. Colleagues familiar with the work of Knowledge for Healthcare will know that we do love to use driver diagrams as a way of presenting the various areas of our work. Shown on the slide here is a slightly abbreviated version of the workforce driver diagram as it appears in the strategy. The standard format for these driver diagrams is a strategic outcome leading to 2 or 3 specific outcomes and followed by a series of interventions which outline the work that needs to be done. So let's have a look at this driver diagram for workforce planning and development in more detail. First of all, we have the strategic outcome. The knowledge and library services workforce has increased capability, confidence and capacity to meet the evolving knowledge and information needs of the healthcare system. We then have the 3 specific outcomes. NHS bodies optimise the expertise of knowledge and library staff. There is effective national, regional and local leadership, planning and development of the specialist health knowledge and library workforce. And the NHS knowledge and library workforce is diverse and inclusive, skilled, flexible and confident. Let's look at the interventions now. Engage with employers to expand and develop the health, knowledge and library services specialist workforce, including embedded roles. Advise on service and role redesign, supporting both employers and knowledge and library services teams. These 2 are both key areas of our regional role, and we often speak with organisations when a member of staff is leaving to discuss options for replacing or redesigning the role within the service. We will often assist service managers or organisations in planning job descriptions, shortlisting, interviews as well as service redesign. Moving on to the third, establish the NHS as an employer of choice. This involves working with a range of partners, including schools of library and information science, to ensure that library school curricula include information about health librarianship as a career, but also working with NHS careers to make sure that NHS knowledge and library roles are included in the careers information. The next one, deliver and evaluate a continuing professional development offer for health, knowledge and library staff involved by needs analysis. Build a digitally confident knowledge and library services workforce. HEE has worked with CILIP on the Technology Review, a response to the TOPOL review, which considers the changing roles of our workforce in relation to digital technologies. Our NHS Knowledge and Library workforce has access to the new Professional Knowledge and Skills Base, PKSB, and the associated healthcare sector guidance notes through Health Education England's learning partner status with CILIP. This guide to skills and competencies now includes digital skills emerging from this technology review, including areas such as algorithmic literacy and computational sense. We will continue to work with partners to deliver development opportunities reflecting these new digital skills, including offers such as the library carpentry course. The next, enhance management and leadership capability. And many of you will be familiar with the offer that's included the mid-career and senior leadership courses. We will continue to review and improve these offers, as well as developing new opportunities, for example, for new and aspiring managers. We will provide resources and opportunities to grow, build and develop diverse and inclusive knowledge and library services teams. Monitor the profile of the NHS Knowledge and Library Services workforce and plan to address capacity and capability issues. In this context, you'll appreciate the importance of the Part 1 statistics which we collect, which are our main way of knowing the numbers and types of staff present in our services. And finally, work with partners to influence the education and training of the current and future knowledge and library services workforce. This includes both work with higher education institutions to develop a presence on library school courses, but also opportunities to influence alternative routes in the profession, such as the apprenticeship schemes. As an important part of developing the workforce, Health Education England promotes professional registration with CILIP. We rightly seek to be recognised as one of the healthcare professions, and professional registration and revalidation is a key way for knowledge and library professionals to demonstrate commitment to the profession and to ongoing professional development. The strategy itself states, Health Education England encourages all library staff to gain professional registration via CILIP. It encourages the use of the Professional Knowledge and Skills Base, PKSB, both by individuals and by teams as a service development tool. Over the summer, each organisation will be submitting its outcomes framework self-evaluation and thinking about service improvement and action planning. As we think about future developments, the PKSB becomes an excellent tool to assist managers in identifying the skills needed from their knowledge and library team and to help identify skills gaps. Health Education England is currently working on the development of a Skills and Learning Academy for NHS knowledge and library staff. This academy will work to secure a sound talent management pipeline, address workforce skills shortages and gaps, support role extension, expansion and enrichment, offer accredited knowledge, skills and qualifications, encompass leadership development, digital skills and continuing CPD opportunities, explore a new apprenticeship at level 7 under the leadership of CILIP, and improve careers information. Much of this work is already underway, and one major milestone is that we hope to gain CILIP accreditation for the range of our courses for NHS Knowledge and Library Specialists later in 2021. I imagine that many Knowledge and Library Specialist colleagues on the call will have benefited from the range of training opportunities offered through Health Education England. I know that I myself have personally attended several of these events and found them very useful for my own professional development. The strategy reminds us that this training programme is informed by strategic priorities coupled with the findings of the biennial survey of development needs. It's responsive to hot topics identified by trust staff and horizon scanning. Health Education England also supports self-directed personal and professional development via the online learning zone, designed for qualified and paraprofessional knowledge staff. There are leadership development opportunities which equip knowledge and library specialists to become the leaders of tomorrow. And the slide provides some bullets reminding us that these learning opportunities are provided through on-site tailored face-to-face or virtual training, blended learning opportunities, externally facilitated events, service improvement projects, opportunities to share skills, to shadow and to mentor colleagues, and obviously our networking opportunities. We've mentioned earlier in this briefing the growing importance of the digital agenda and the profession's response in the form of the CILIP Technology Review and the refreshed professional knowledge and skills base, together with some early responses from our own development offers in HEE. The strategy tells us the NHS is hungry for solutions that bring evidence from research, data and information from a myriad of sources together as actionable intelligence. Machine learning, artificial intelligence and robotics are reshaping the way that teams create, discover, use and share information. We expect the emergence of new roles and responsibilities for knowledge and library staff working alongside clinical teams and health informaticians, and see fresh opportunities for paraprofessional staff to also develop new roles and skills. In response to the Topol review, CILIP is leading an inquiry into the impact of new technologies on library and information roles and ways of working. Building on the findings, Health Education England will develop education and training to meet the needs of the current and future knowledge services workforce. And the document referred to here is obviously the CILIP Technology Review, which we now have available and are already responding to in terms of implementing areas from the professional knowledge and skills base. So it's great to have all these plans for the future, but sometimes it's also good to reflect on progress. And this slide, based on the information contained within the Knowledge for Healthcare strategy, focuses on progress within the workforce development workstream over the last 5 years. You will see some recurrent themes here in terms of our plans to take forward. So we've assisted employers with resources for role redesign. These documents have been available through our website and are currently being reviewed so that they match the new CILIP PKSB. We've offered extensive CPD opportunities informed by development needs analysis. We've enhanced the professional knowledge and skills base working with CILIP. We've developed a learning zone for self-directed learning amongst our knowledge and library services workforce. We've worked with higher education institutions to nurture the talent pipeline by providing a presence on their library school courses. We've worked closely with CILIP on the introduction of the Level 3 Libraries, Museums and Archive Apprenticeship. We've provided leadership development opportunities for mid-career and senior librarians. We've started to initiate training and dialogue on inclusivity, diversity and equality, though we recognise there is much to do in this area. And we've delivered training in summarising and synthesising evidence, mobilising knowledge and health literacy. So this brings us to the end of the session focused on workforce development in the new Knowledge for Healthcare strategy. I hope that you've found the session useful and informative. We do encourage you to take a look at the Knowledge for Healthcare strategy. And we also have an executive summary and an easy read version available on the website for you to read. Thank you for listening.